House of Parliament and the end of...
The National Assembly's Health Committee has identified several hiccups in the implementation of the Social Health Authority and the transition to the Social Health Insurance Fund.
The urgency with which we passed these laws, and again, the urgency with which we want to have them implemented, we will not meet any of these targets.
The committee has found out that the Social Health Authority lacks an organizational structure, preventing it from taking over the national health financing role from the NHIF. There are only approximately 4 months left before NHIF's mandate lapses. Within this time, the organizational structure must be established, Kenyans registered, and Social Health Authority operationalized.
NHIF currently has got so many staff. How far have we gone even in terms of appraising?
The HR instruments were completed in April and they were submitted. Remember, before they are approved, you cannot begin any process.
If we are waiting for the instrument to be approved, then it looks like we may not necessarily hit the date.
The authority has blamed court cases for delaying the registration and approval of human resource instruments critical for the rollout of SHIF. The Ministry of Health further states that SHA is awaiting approval of HR instruments by the Public Service Commission.
The court gave a ruling on that on the month of July. So you can see the delay that has been caused not out of the making of the ministry or the SHA, but because of the court cases.
You have a new establishment. You have a new, old staff. How do you transit them? Especially with accountability, claims, reimbursements. How do you transit them and hold them accountable should anything go wrong?
As of this morning, 464,263 Kenyans had been registered on SHA, a small fraction of the total number of Kenyans who need to be enrolled, with both Ministry of Health and SHA officials struggling to explain the registration systems to the committee.
You're saying you're in the process of procuring. How are we registering members already in a system that is under procurement process?
We are using the current systems of SHA to register members.
Current systems of NHIF or SHA?
The SHA. We created a new portal under SHA.
The system was configured in-house to allow for registration. So once this has been, once the registration is done, now it's supposed to integrate with the main system that is currently on an advanced stage of procurement.
The emerging uncertainties come at a time when Kenyans have in multiple instances complained of suboptimal services offered by NHIF, hoping for a change with the incoming SHIF. Ben Kerera, K24, Nairobi.